Respiratory World. This is checking in for respiratory and fitness. Speaking a little bit about how it is working in the healthcare industry right now with the current crisis that's going on. We are experiencing um, people with exposure, coming into the hospital, and as healthcare professionals, we are here to do what we are here to do, and that's to give the best care to our patients, um, possible. We are, exercising the proper precautions that we need to exercise in order to, give our patients care. Using the correct PPE equipment, proper hand washing techniques, and we're working in the emergency department. We're really not sure who has already been exposed, so we are wearing PPE in the emergency department. I know it varies hospital for hospital, but that's what we're doing here. And so we just really exercising the proper precautions to make sure that we are able to give the best care that we are able to, that we should be able to give to our patients, and protect ourselves as well. It's a little different for us, so for me, because working in respiratory, this is the first time I experienced a pandemic such as this, a viral pandemic that's been the people has been dying from, and in large numbers. Before, people were like kind of comparing it to the mortality rate of the flu, and saying it was similar to the flu. But right now, the rate of transmission is so high that it's something like we've never seen before. It has the ability to travel up to 6 feet from the person who's infected by droplet. And if it gets into maybe a mucosal space like the mouth, the eyes, nose, that's the rate of transmission. I mean, that's the way it's transmitted. But they are still doing testing, and the testing for the virus, this particular one, the turnaround time is I think between 2 and 4 days. So they really are just pushing social distancing. Like, I mean, if you are experiencing symptoms, maybe like fever, difficulty breathing, and it's if it's manageable, I think that they are advising people to stay home, instead of coming into the hospital and spreading it. They think that the symptoms will last up to 1 to 2 weeks. I am not licensed to give medical advice. I'm just speaking about what I've seen so far. So social distancing is probably the best practice right now. We're advising everybody. We know people are going stir crazy in the house because they don't really want to be in the house. They want to be out and about, doing what they want to do. But right now, your health is more important than you being sociable. So limit your exposure to crowds of people under 10 is what I've been reading. Make sure you wash your hands, when you're touching surfaces, or you're touching, you're going out in public and you're shaking your hands and stuff like that. I would probably avoid, shaking hands altogether as well, just to exercise the best precaution, so you can have the best outcome possible, because you don't want to be, affected with this. They are saying that some people are asymptomatic, which means they have no symptoms at all. Some people, are able to, after exposed, if they quarantine themselves, they can probably get over it in like 1 or maybe 2 weeks. So there's no reason to be a hero. There's no reason to put yourself in a predicament or situation that you don't have to be in. There's no reason to, not practice social distancing with all that's going on out here in the world. And we really still don't have a lot of the facts, to make the best decisions right now. So we're just, trying to prevent the spread of the illness from spreading to more people. And that's the best way that we could probably get rid of it right now. I do believe they're working on a cure. None that I've seen yet, but this is my PPE that I've been rocking where I go, in patients' rooms, even if they aren't, on precaution, because some people are asymptomatic, so you really have to protect yourself, and us as healthcare providers, this is what we agreed to do. This is what we decided to do as a part of our career field. I mean, I love what I do. So, just want to say thank you to everybody else in the healthcare industry that's out, putting ourselves out there and, making things happen for the rehabilitation of the patients and making sure that, hoping that, we can get them back to the best possible state of health because, it's serious. It's a serious illness. It's really, those are the people that it affects. It first, messes with the respiratory system and it makes the lungs kind of stiff, so it doesn't have the functionality that it normally has. I mean, and then it also starts affecting other systems, organ systems in the body. So just to stay aware, stay awake, wash your hands, and definitely practice social distancing. All right, until next time, that'd be cool. Respiratory fitness.